Yeah. So I pinch the skin and I inject it right into the muscle. And there's a little bit of a welt. That's the Botox. That will go away in about 10 minutes. Go again. She obviously doesn't have many wrinkles, so she doesn't need very much. And I do a little on the bridge of the nose, because if you get Botox between your eyes and you don't treat the bridge, you'll start getting lines coming across the nose.
So basically, is it just paralyzing the muscle that makes that movement?
Absolutely. So as you scowl or raise your eyebrows, that's your muscle contracting, and the Botox is going into that receptor and blocking it.
Right.
Lasts about 3 months in general. Some people can last a little bit longer, others a little bit faster. That can vary depending on your cortisol, which is your stress hormone. If you're stressed out, you're going to break down that Botox faster, unfortunately. Big smile.
Botox on like certain individuals?
Doing a little bit on your cheek.
And you use such a butterfly needle. It really
It's really tiny. That's it. She's all done. Any questions?
It hurt?
It's a piece of cake. In the first 24 hours after an injection, I have my patient really over-exercise the area that was injected, and that action really gets the Botox into that receptor and really stuck in there. It works better. But in general, 3 months. The longer you do Botox, the less often you'll need to do it. It actually atrophies and shrinks the muscle. All right, that's it. We're doing another Botox. So I'm going to be doing Botox in 2 different areas on her. Around the eyes for crow's feet and in between the eyes. First, of course, we want to clean the area with alcohol.
You don't have those horrible wrinkles on your forehead.
No, she doesn't. She's beautiful skin. Yeah. Okay, so you smile for me. Big smile, big, big, big. So all I do is really put the Botox superficially all around the eye. If you get woozy, don't watch. And the Botox usually activates within 2 days and 14 days. Anywhere in the 2 weeks, it activates. How often do you do it? It lasts about 3 months. Big smile. It lasts about 3 months. Some people can get 4 months out of it. Complications, bruising. But if you put pressure on it, everybody's a little different. Depends on how thin your blood is. Things to help prevent bruising. You avoid anything with aspirin in it. No Motrins, no leaves. Anything with the aspirin you want to avoid. You also want to avoid a multivitamin because it has fish oil and vitamin E. You want to avoid that. And you also want to avoid actual fish oil pills. I would avoid things 3 days prior and 3 days after. Arnica. Do you guys know what arnica is? It helps dissolve or diminish a bruise. Actually, I'm just going to talk about arnica. So if I notice that you're really thin blood, you're going to probably bruise, then I do suggest arnica. And that basically, you want to talk about arnica? It has vitamin K, it dissolves bruise. And Max, turn towards me. And now we're going to go in between the eyebrows, scowl, angry.
Oh, yeah.
So she has what we like to call the 11s. And so I kind of just go in sort of a V formation into the muscle. This is a deeper treatment. Around the eyes, it's more superficial. If there's a little bleeding, you just put a little pressure. There are going to be the little welts, the little swellings, that will go down in about 5 minutes. You want to avoid any exercise about an hour or two after your treatment. You also don't want to lie down, have a facial, do massage an hour or two after the treatment either. It moves the Botox places I didn't put it, which we don't want.
But beyond that, so 2 hours later you could work out
2 hours later,
facial
you're
and
fine.
stuff?
And you always want to go around the bridge of the nose, because if you don't, you'll start to get lines across, which we call the bunny lines. We don't like it. That's it. Wow.
Oh, that's quick.
That's it. Did it hurt?
No. Not really. Not at all.
A little pressure. Can't feel it.
I mean, you feel
A little pressure.
Yeah.
That's filler. Filler filled. So if you have a scar or an actual depression or a trough, then you want to fill it with, I usually prefer Juvederm. And there's lots of different kinds of filler that you can chat about. But filler lasts about a year. It's a little different than Botox lasts 3 months. Question? It's super quick and easy.
Mayor David Lim.
Well, hi everybody. I will keep it short and sweet because I know the real celebration's inside with the food and the drinks, and it's kind of windy out here and a little chilly. But I just want to welcome you all to San Mateo to Physicians Youthful Resources. I was telling the doctors here that it's always neat to see a diverse business come into our city. And I've never opened up this sort of business before. I think it's wonderful. I had a chance to talk to Lindsay a little bit. You know, we were talking about her time at Highland Hospital in Oakland. I'm a DA over in Alameda County, so we kind of bonded about that. But I think it's just wonderful, the type of services that they're going to be providing to our community. And so I wish you all the success, and if you ever need anything, I've already given you my card. Feel free to call me, and let the celebration commence. So welcome.
Thank you. I think in San Mateo you're not open until you have your residency.
For being here. Come on inside, get warm, and keep eating and drinking as much as you like.